Set of implants from 2007. This is when the implants were determined to be nice and safe and approved to be used for cosmetic reasons under experimental conditions, if you will. So here is a complete end block, 12, 11, 25, initials KG, patient from Canada. And as you will see, complete removal of the entire implant and the capsule. And as you will see, these are the markings of that pericardium, that's the cartilage part of the rib. And so as I go in, done end block. Now interestingly, she went to get an MRI in Canada and they said that there's going to be a long wait, like over a year, and she ended up going to Buffalo and she herself wanted to get a MRI, and lo and behold, the MRI said that both of these implants had a rupture. And you know, she had capsular contracture, mastitis on the left side. And as you will see right here, let's see if the MRI, this is a lot of patients who have implants and they thought that they're lifetime devices, and you can certainly see, look at this implant, relatively very thick capsule, and this is that ruptured implant, as you can see. And look at all this, it is not cohesive anymore. And you can see how it is melting. And so look at the orange tinge on the inside, relatively very thick, all contained, and this is the purpose behind the end block. What I'm going to do here is, there's a soft tissue here. I'm going to cut through this. You can see a lot of inflammation. Look at this fat. It's like a little bit on the dark gray, yellow fat. This is not healthy, and hence that has been removed. So as you will see right here, it has a brown tinge to it, complete removal of the entire implant capsule. And I'm going to go ahead and put this here. Very tedious dissection, very tricky. And if I look over here, yep, I'm going to go ahead and pick it up. And you can see, look at the way it's ruptured right here. Look at that. So the outer shell is made up of a different material, and the inside is different. And you can see, look at all the stickiness right here. I'm going to go ahead and, you can see the manufacturer right here. To get a nice angle. So Mentor, Allergan, Sientra, they're very good about writing what is the name of the implant. I'm going to go ahead and too shiny. I cannot read it. So as you can see, look at this. None of this spilled into the chest. No need for drains. Actually, she did not even need a true lift. She's going to do very well with this excess skin removed. Now the other thing I want to point out here is, if I hold this up, look at, this is exactly how the implant was sitting, literally. It was protruding straight up. This is exactly right behind the nipple. And you can see a done end block and complete removal of this entire inflamed tissue, hard like a rock right here. It was very tricky, and literally this is how it was sitting on her chest, this protruding out underneath the muscle, right on top of the rib, and done end block, the gold standard. And I'm going to go ahead and literally cut through here. I just want to see what it is, because it's extremely hard. Looks like an extravasation. You can see how hard this tissue is. All of this abnormal tissue, hard tissue, has been removed. So you can see how hard this tissue is. I'm going to send it along with the capsule. And let me go ahead and go in here. Let's see how soft this is. I'm going to actually go in from here so I don't hurt my scissors. Let's see how the implant was sitting. So this is the part that was the closest to the nipple. Very hard. She had silicone mastitis. And if you go in and have a look, very yellow, hard, looks like inflamed tissue, very thick. All that tissue removed. Look at this tissue. Very inflamed, thick and angry. If you go in, you'll see droplets of silica. Right here, look at this, some fluid. Look at the color consistency. And if you look at the inside, it's very interesting. Look at the inside. There's white particulate matter on the inside. And let me see. I'm going to actually take this. This is your 400 mentor implant. You can see from the color. You can see a lot of stickiness right here. And again, look at the white on the inside. Very interesting. Right here. So let's look at this capsular tissue. Very thick, indurated, inflamed, angry. Everything felt bad, abnormal, irritated, all removed along with the capsule and the implant. So there you have it. Let me go ahead and look at this again. Again, you can see, look at this white matter on the inside. So the implants will be returned to the patient, capsules to be sent to pathology, rule out the rare BIALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how the patient does. She had definitely irritation of the right and certainly on the left. As you can see, the inflammation that's present around. There was extensive inflammation around. That was all incorporated along with the implant capsule and all inflamed tissue as one system, as you saw, with only good, healthy, viable tissue remaining behind. The dissection on top of the rib was certainly very tedious, very meticulous, invasive, but I couldn't be happier. Blood loss was minimal, no need for drains, twilight deep sedation. Capsules to be sent to pathology, cultures for aerobic, anaerobic, and fungal, implants returned to the patient. She gets the same surgery as the 83-year-old patient got earlier in the week, and the other patient at the hospital with the high BMI. So there you have it. This is Dr. Khan, Executive Plastic Surgery.